for some common symptoms that people may experience with some hormonal imbalances going on in their bodies. Some of these are very common. We talk about them a lot. Others are not so common, or people feel even ashamed to talk about them from time to time when they're experiencing these symptoms, or they brush them off as being normal, to just being of a certain gender, a certain period in life. But you should not be suffering because of a hormonal imbalance in your body. There are ways to address it and find that balance again. So one very common one, for instance, is the HPA axis dysfunction, or we also refer to it as adrenal fatigue or adrenal burnout, hypothyroidism, hyperthyroidism, polycystic ovarian syndrome or PCOS, premenstrual syndrome or premenstrual dysphoric disorder, PMS or PMDD, endometriosis, dysmenorrhea, oligomenorrhea, amenorrhea. These are all related to your menstrual cycles, infertility, pregnancy, menopause, perimenopause, childbirth, and postpartum. These are all different phases of your life that you could be going through some sort of hormonal imbalance. This is for both men and women. Stress is probably a very common factor in affecting your hormones. Stress and sleep. Lifestyle is also very important, but there's not a one-size-fits-all to cure all hormonal imbalances. Everybody is individual, and everybody deserves to be treated as that individual and actually addressed for what they're going through in their life at that particular time, and how to make that easier, and how to make things more balanced in their life, even if they are going through a stressful period of time, or they are postpartum and they're not getting enough sleep. Talking about HPA axis dysfunction or adrenal fatigue, you're kind of referring to basically what everyone seems to be going through these days is just straight burnout. Your diet, your lifestyle, your body is constantly in a state of stress, releasing cortisol, epinephrine, norepinephrine, and you're experiencing things such as low energy, brain fog, fatigue, diarrhea, constipation, low immunity, feeling like depressed or anxious all the time, trouble sleeping or falling asleep and then popping up at a certain time every night and not being able to go back to sleep. These are all signs that your body is in some state of fatigue. And do not forget that it's not just environmental stressors that could be causing this, like your job or your family life or money problems. If you have any sort of food allergies or food sensitivities or infections or things that are reoccurring in your body, that can also put a stress on your body. That can also cause adrenal burnout or adrenal fatigue. So look into what are the things in your life that are putting a strain or putting too much pressure on you, either physically or emotionally. And those are the things that could be causing this imbalance in your body. With hypothyroidism, your thyroid basically gives you energy. So if you're experiencing extreme fatigue, sensitivity to cold, hair loss, sudden weight gain, and having a really hard time losing that weight, brittle nails, brain fog, brittle hair, anything that basically, even lower immunity, infertility, painful periods or skipped periods, these can all be signs that your thyroid is underactive. We don't want our thyroid to be underactive. We also don't want it to be overactive. We want to make sure it's behaving the way it needs to. Hypothyroidism is very common and many times runs in line with adrenal fatigue or HPA axis dysfunction. Keep an eye out for those symptoms. If you have constant brain fog or fatigue, that is not normal. Please visit an integrative practitioner such as myself or somebody else. At least at minimum, go to your regular primary care practitioner, get a full thyroid panel. A lot of times your labs may come out normal, or just your thyroid stimulating hormone, which is your TSH, could come out normal, but there can be more happening. So make sure, if you feel like you are chronically exhausted or feel really burned out, you really want to look into that. If your doctor turns you away, visit an integrative practitioner. Hyperthyroidism is less common than hypothyroidism, but that's an overactive thyroid. So an overactive thyroid can make you jittery, it can cause sudden weight loss, it can cause an enlarged thyroid or goiter, it can cause sleep issues or diarrhea. It's more of a jittery feeling rather than a very tired feeling. So it's kind of a good way to look at it. A lot of times it can be genetic, but even so, you can still avoid from this getting out of control by utilizing the right diet, lifestyle changes in your life. So if you feel like you're jittery all the time, or you feel like you're losing all this weight, don't get too excited. We don't want sudden weight loss for no reason too. We want weight loss to be healthy, we want it to be moderate, we want it to be for the right reasons. So keep an eye out if you're experiencing any of those things. If you feel any pain or you feel any discomfort or enlargement, check it out. Go to your primary care physician. Make sure they get a full thyroid panel. Again, you want a full thyroid panel. You don't just want to check your thyroid stimulating hormone, and make sure that they look into it. You can also visit an endocrinologist, which is a hormone specialist, or an integrative practitioner such as myself if you feel like there's something going on. Now, PCOS is probably the most common endocrine disorder for women of reproductive age today. 1 in 15 women in the US are dealing with PCOS. That is insane. And to be honest with you, I see a lot more of that in my practice. I would say 5 to 10% of women in the US suffer from PCOS. A lot of times the reasoning is unknown, but we probably can gather that some of it is diet and lifestyle, because it is becoming so common out there. It can be an excess of caused by an excess of certain hormones. It could be caused by an inadequate amount of other hormones. It can present itself in different ways. You can have cystic acne, excessive facial or body hair, hair loss, stubborn weight gain, and also being very, very difficult for you to lose that weight. You can have irregular menstrual cycles, or very painful menstrual cycles, or absent menstrual cycle. You can have insulin resistance many times, and there's a big correlation for most women between insulin responses and polycystic ovarian syndrome. These are cysts that are actually on your ovaries that can cause a lot of pain and inflammation, but you may not feel that. You may start with very minor symptoms. So you want to keep an eye out. Any irregularity in your menstrual cycle, any sort of unwanted acne, any hair loss, any sudden weight gain, it can run parallel with a low thyroid as well, but you want to check out both all of your hormones that are related to polycystic ovary syndrome or ovarian syndrome, as well as a full thyroid panel, so you can pinpoint. A lot of times you will go to a gynecologist or primary care physician, and if they see that you have the symptoms, or you get an ultrasound done and they see that you have cysts on your ovaries, they will automatically give you some sort of diabetic medication that will help with your insulin responses, or they'll give you birth control. That is not going to heal you. And I'll just tell you now, it's a Band-Aid, and you will have to deal with it in the long run. There are so many things you can do to improve your PCOS. Do not starve yourself. Again, it's the same thing as having hypothyroidism. You do not want to starve yourself when you have a hormonal imbalance. That can actually cause you to gain more weight. You want to have the appropriate diet and lifestyle changes. You want to eat the right foods. You want to engage in the right exercises for your body. So please keep in mind that whenever you see sudden weight gain or weight loss, do not take it upon yourself to diagnose yourself. Make sure you get a full panel done. And if your doctor is resistant to trying to do it the more holistic way or the more integrative practitioner way, you can always visit an integrative practitioner that is willing to heal you from the core and not just put you on some pills as a band-aid, because that is not going to heal the core issue, which is there's some sort of imbalance hormonally in your body. Now, PMS we've normalized for many years. Premenstrual syndrome, oh, that girl's PMSing, or oh, I'm PMSing, and you're going to sit down with your girlfriends and eat a bunch of salty and sweet snacks and be like, oh, I'm so bloated and I'm so uncomfortable and all of that. Extreme PMS or PMDD is common. However, it is not normal. You don't want to break down in tears constantly before your period or even at other times. And PMS doesn't necessarily have to be right before your period. It could happen at other times if the hormone shifts are taking place. So even if you don't menstruate, you can experience PMS. For a lot of those PCOS clients that I see, they still have PMS symptoms, but they're not actually menstruating. So you don't want to feel sadness or fatigue or excessive bloatedness or headaches, brain fog, confusion. A lot of these things can happen before or while this PMS or PMDD is taking place. So couple things to keep in mind. Yes, I know, ladies, we have crazy cravings and we do want to eat all those processed foods, but unfortunately those processed foods tend to actually make us feel more bloated and worse. So when you are menstruating, you're probably better off eating those foods, even though you probably stop craving them as much. But prior, you want to try to limit them as much as you can so it doesn't interfere with your moods and the way that you feel, and you're bloating even more than you're already experiencing. You want to take it easy. You want to kind of shift the way you're exercising before. You want to make sure you're getting plenty of nutrients before you're menstruating. You want to make sure you're getting wonderful quality protein before you're menstruating. And it's okay to indulge from time to time. You want to make sure that you're getting what you need before you indulge on all those processed foods that could actually make you feel worse. Endometriosis is basically these painful lesions that are formed by endometrial cells outside of the uterus. It can cause a lot of discomfort and really affect many people's lives. And it's something that is sometimes not diagnosed until somebody is experiencing infertility or really horrible heavy periods, because the doctor will say, okay, get on some birth control. And when that happens, you're masking the symptoms and you're just putting a band-aid on it again and making it sometimes manageable, sometimes barely manageable. But what happens is you want to address the root of the problem. When you're experiencing that horrible pelvic pain, depression, anxiety, horrible periods that are making it impossible for you to get up and complete your daily tasks, a lot of inflammation or a lot of bloating down there, painful intercourse. All of these things are symptoms of endometriosis that may be manifested later down the line. It could be silent for a very long time. It's hard to diagnose. I highly recommend, if you have any sort of pain or discomfort during your menstruation, go to a specialist or hormone specialist that's actually going to look deeper into what's happening. If you've been trying to get pregnant for over a year and that's not happening, try to go to a specialist that can help you. You could possibly have endometriosis, and it is a little more challenging to diagnose. There are many things that you can do to manage the pain. It can be challenging, but there are things that you can do, and getting on birth control is not going to fix the problem. It is just going to be a temporary fix to relieve that temporary pain. You can heal even something as simple as with the pelvic pain. There's physical therapists that specialize in physical therapy for the pelvis for endometriosis patients. Let's talk about our periods. So there's 3 different hormonal imbalances you can experience when talking about periods. There's dysmenorrhea, which is really painful, uncomfortable periods. There's oligomenorrhea, which is irregular or lighter periods, which is also common. And then there's amenorrhea, which is either an absence of a period, meaning a woman is not experiencing a period by the age of 16, or it's been about 9 months where from irregular periods a woman hasn't experienced a period, or 3 to 6 months of just regular periods and then no period at all. So you don't want to get super excited when your period stops or when it gets really light. You don't want it to be super heavy again, but you don't want it to be super duper light or skipping months. You do want to menstruate every month regardless of what your primary care or your OBGYN says. It is a way for the woman's body to heal. It is part of our cycle, and without our cycle, that means that something is quieting our hormones down, whether it's birth control or something else. So we want to be mindful of being on a regular cycle and having them pretty consistent. We may change from month to month, but we don't want it to be a drastic change, or we don't want our periods to completely stop or go from being super duper heavy to a couple spots here and there. So ladies, check your periods. Just like I tell people, after you use the bathroom and check the toilet, you always want to check what's going on down there. Do not be ashamed of it. Do not be grossed out by it. It is the beauty of being a woman, is that we are given this magical cycle, and it's kind of like an inside informant of what's going on in our bodies. So if your mood changes or your life changes, or you're traveling a lot, you might see changes in your menstruation. Pay attention to it. Give your body what it needs. Infertility. It is a sensitive topic, and rightfully so. It's becoming so common, and we don't know exactly why it's happening. It could be the environment, it could be our food, it could be our lifestyle. Women are trying to have children at older ages. And it's not just up to women. A lot of men can be low in fertility or infertile, and it's interesting that women are usually getting a lot of the blame when men can also have something to do with it. So ladies and gentlemen, if you're trying to conceive, you want to check both parties out. You want to make sure everything's functioning well, and I also do highly recommend that 3 to 6 months before trying, making sure that you're detoxing or you're decluttering the body of a bunch of things that you don't want it to have, that all of those toxins, all those metals, the excessive mercury, the excessive BPA and hormone disruptors that we get from our environment, from plastics, from seed oils, from not exercising and not sweating enough. Those are the things we want to get rid of prior to trying to conceive. If you are experiencing infertility, which means you are not able to conceive within a year of trying, basically infertility is a lack of ovulation, or ovulation not occurring the way that it's expected to. So we want to pay attention prior to trying to conceive. So when you start trying to conceive, you can keep track of your ovulation or lack thereof and try to get to the source of why that may be happening. It can be another hormonal imbalance that's affecting this, and so I do recommend going to a hormone specialist, visiting an integrative practitioner such as myself, changing your lifestyle and diet habits, and making sure you're getting plenty of sleep, and making sure that the things that are on you and around you and going inside of your body are conducive to somebody who is trying to conceive or trying to create a life. Both men and women need to be cognizant of their fertility if they're trying. It is not just a female thing. It is such a misconception. Gentlemen, if you're smoking marijuana every day, or smoking vapes, or not exercising, or you're on some fast food diet, you do not want to conceive a child in that condition or at that point in life. Optimally, being balanced and healthy prior to conception is what we're looking for. Perimenopause can be very scary because we think that it's a sign that we're aging, but perimenopause can start early, and then we could be getting our periods and being able to conceive children for months to years after perimenopause takes place. It is when the estrogen drops, so we want to just make sure that if all of a sudden we're 40 and we're experiencing breast tenderness or irregular periods or lack of sex drive or low libido, brain fog, pretty much all of the symptoms you would probably have with other hormonal imbalances. If you see any change around that age, you could be stepping into perimenopause. Do not worry though, because you could have years left before your menstruation actually stops. Between 40 and 45 is usually when people start really experiencing the signs. But if you're experiencing sudden mood swings and your periods are getting a lot harder on you and they're becoming a little different, or they look different, or they feel different, just look into it, get your hormones checked, visit an integrative practitioner. If you feel like your diet and lifestyle are not conducive to a perimenopausal woman, it is important to know what to eat and what to do and how to exercise at each phase of your hormonal lifespan. So keep an eye on that, ladies. I know it's kind of an uncomfortable conversation to have, but don't worry, 40 is the new 21, according to me and many people. So don't worry about the aging process. Worry about giving your body what it needs during that process in order to optimize your hormones. So after perimenopause, we experience menopause. Menopause is very scary for a lot of us women. Some women are celebrating because they've had such uncomfortable menstruation their whole lives. They're like, hallelujah, I don't have to deal with this every month. But with menopause, a lot of symptoms can finally come into play. Hot flashes, weight gain, hair loss, mood swings, excessive hunger. Women tend to sometimes refer to it as like PMS on steroids. So it's the end of your reproductive phase as a woman, which means there's not enough estrogen formed in the body to form and release these eggs anymore. So, you're kind of like, okay, at least I don't have to deal with trying to use some form of birth control, but now you're dealing with things like vaginal dryness and mood swings and discomfort and weight gain. So there's ways to work through this stuff, ladies. It's not the end of the world. There is life after 50 or 55. You can still feel young and vibrant. You can still do things that you enjoy. And it can actually be a new chapter in your life of not having to deal with the menstruation every month, but giving your body now what it needs at this phase in life and living your best life at without having to deal with all of the cyclical stuff that you were dealing with for that first half of your life. So I urge you to try to look at menopause as not as a scary thing, but just another phase of being a woman and growing and maturing and living your most optimal life. You do not have to suffer. You may experience hot flashes, but there are ways to manage it. There are ways to actually make the symptoms minimal. So let's talk about the phases of pregnancy. So in pregnancy, you have childbirth, then you have postpartum. Pregnancy, everything kind of is like pumping in your body and thriving. You have high levels of HCG, relaxin, oxytocin, progesterone. All your hormones are whirling around, which is probably why we have so many ups and downs as pregnant women. We have really happy times, really sad times, and sometimes some women tend to be more on the sad side or more on the happy side. That's why a lot of times people say, wow, you have that pregnancy glow. These are all hormones that are pumping through our bodies and making us grow this beautiful miracle inside of us. However, it does come with a price. It's not easy. It's not easy to realign. It's not easy to deal with all these changes in the body. And sometimes things can happen, like we could be too flexible, or we could be a little more swollen, or we can feel more nauseous than normal. So it's not all wonderful, although the outcome is wonderful and it is a beautiful miracle, but it is a tough time to adjust to for many women. Some women have easier pregnancies than others. Some have less hormonal fluctuations that are as extreme as others. So it depends from person to person, and it is a very individual thing. But there are a lot of things happening hormonally while you're growing that baby inside. Then you go into childbirth, and with childbirth, your estrogen, your progesterone, they kind of go back to normal eventually. But if you are breastfeeding, you have other things still whirling around like oxytocin, and you're going to experience maybe more of an appetite, and you're going to experience still some mood swings. You may be weeping out of nowhere when your baby cries. There's so many things that are happening and releasing that it's not just a physical emotion, but it is a hormonal emotion too. You do have a lot of ups and downs. And then you have that postpartum phase. And the postpartum phase for some is not as difficult as it is for others, but for most women, this is a very challenging phase. You are dealing with a new life, you have a lack of sleep, which also affects your hormones, and now all your hormones are trying to go back to where they started from. And that tends to be pretty taxing on the body. So all of that progesterone and the estrogen and the oxytocin and all of those things can cause mood swings and depression and anxiety and hair loss and weight gain and weight loss, and you don't know what your body's going to turn out like. You have all this loose skin, and you're healing, and you're dealing with sometimes incisions or scars, and those things are releasing a lot of hormones and cortisol, and you could be really stressed out about the conditions of what may happen to this precious little life that you just brought into the body, and that can cause an HPA axis dysfunction or thyroid issues. So you want to pay attention to all of these phases. Your thyroid function is also very important during pregnancy and postpartum. Ladies, do not ignore it. Your doctor may not look into it. Make sure you are being proactive about your thyroid function, and make sure that everything after the 2 to 3 month mark is going back to normal as much as it should be, based on whether or not you're breastfeeding or how long you feel like your hormones should get back into balance. My name is Shireen. I'm a registered dietitian turned holistic health coach and founder of Health in the City. I hope that this information brings some light into your life and can help you start thinking about some things you can do to get those hormones balanced and live a healthier, more balanced and peaceful life.